The Women's Heart Wellness Program is a program specifically for women of childbearing age at high risk for cardiovascular disease. We use a holistic, multidisciplinary approach to try and help these patients get to an optimal place within their cardiovascular status before, during, and after pregnancy. With pregnancy, the mother's needs increase significantly, so it can be calorie and protein needs. It can also be vitamin and mineral needs, things like calcium and folic acid and iron. When you now introduce a cardiovascular issue, it can not only now bring us to a point of trying to encourage them on the things that they need to include in their diet, but now we have to teach them the things that they need to restrict. We have a series of 5 appointments. The 3 in-person appointments are going to be the lengthy appointments. Each one of them has a specific focus. So the initial focus is really identifying the food label, learning what those numbers mean, and how they relate to the patient and their diagnosis. The second portion is really their meal planning, understanding how to incorporate these foods that are going to help with their pregnancy, their cholesterol, their weight loss, as well as how do we remove some of these foods that might exacerbate some of these heart-related complications. We also have recipes as well that we go through, learning how to kind of find them, identify them, use them, and incorporate them. We also set a health vision, which is kind of a grand idea of what they would like to work on for their health and wellness. And lastly, their SMART goals, which is something specific, measurable, attainable, realistic, and time specific. So a SMART goal gives them the opportunity, instead of just saying, I want to eat healthy, to say, I want to choose 3 servings of vegetables per day, 5 days per week. So they can really identify if they're achieving their goal and how we can continue to motivate them and make progress towards that health vision.